Welcome to this week's edition of Taiwan Outlook. I'm your host, Chi-Chen Lo. Many people have said that Taiwan has one of the best and the most generous health insurance system in the world. However, there are also concerns about the sustainability of the health insurance system. So how's the situation in Taiwan's health insurance system? Joining us today is Professor Xin-Yi Zhou. She is the professor at the Economic Department at Lehigh University, and she is also a research fellow at the National Bureau of Economic Research. Professor Zhou, welcome to our program.
Hi. Thank you. Nice meeting you.
In comparison with the American system, how do you see the health insurance system in Taiwan?
National health insurance was implemented in Taiwan in 1995, and we can say that Taiwan is the latest country which adopted national health insurance, and the healthcare system in Taiwan now is probably the most generous healthcare system.
What do you say is the most generous system?
Well, actually, I can give you, a very simple example. I took my daughter to see the emergency room on Monday, last Monday, because it was holiday in Taiwan, and because of her eye infection. And we did not have national health insurance in Taiwan, so we now went to the emergency room. It only cost us like $25 US dollars, including examination and the prescription drugs. But $25 it will cost the same amount, like $25 to see emergency room, only if you have health insurance in the United States. So we do not have national health insurance in Taiwan, but it only costs the same amount as we do in the United States if we have health insurance. So the national health insurance in Taiwan is very, very generous. It not only covers hospital care, outpatient care, but also covers dental care and prescription drugs. It's unbelievable good, and like in the United States, if you have private health insurance, in the United States, probably 60% of the population had insurance that are covered by their employers. Now, in other words, if you want to have health insurance, you need to have a very good job first. Otherwise, it's very difficult to get health insurance in the United States. And if you have private health insurance, it probably only covers hospital care and outpatient care. The rest you have to pay yourself, like prescription drug. Prescription drug, the coverage is much less generous than the coverage in Taiwan. So it's very good health insurance policy.
Professor Zhou, comparing with other countries, do consumers in Taiwan pay a lot in order to get their insurance?
For the insurance, the cost for consumers is relatively low. The premiums are shared by three parties: government, employers, and employees. So in other words, employees only pay 1/3 of the premiums. So the cost of insurance is very, very low. And in addition to the insurance, the premiums, the co-payment of the consumers are also very low in Taiwan. So like the example I mentioned before, if you have national health insurance in Taiwan, and if I have national health insurance in Taiwan and I took my daughter to see the emergency room, I don't need to pay. I probably only pay like $100 NT for registration and only shared half of the prescription drug. So the copay is very, very low in Taiwan.
But there are also concerns that the government has been paying too much for all the insurance system, but the consumers only share a little bit of it. And the burden for the government is very heavy. How do you think about that?
I think that's true. So this is the government has implemented several different policies, to try to reallocate the resource, try to manage their budget. For example, the most important policy on the hospital care is probably the global budgeting implemented in 2002. Global budgeting was implemented in several different European countries, and the idea is that the government allocate a fixed budget. Hospitals have to share the fixed budget, regardless of how much hospital services you provided to the patients. You can only share a fixed budget. So, in order to, continue the national health insurance, the government used many different policies, but global budgeting is probably the most influential policy so far.
Yeah, but in addition to the costs and the benefits of the insurance system, the key issue here, another issue is the so-called medical service, the quality of medical service. Does the newly introduced health insurance system reduce the quality of the medical service in Taiwan?
I think after a couple years after the implementation, the quality is was considered to be good, but after global budgeting, there will be a lot of issues. There is always a trade-off between quality and cost. If you want to control the cost and to maintain the quality, it's an issue that the government need to consider. Because the implementation of global budgeting, the hospital has to share the fixed budget. So no matter whether you treat a very healthy patient or a very sick patient, you always get the same amount from the government.
That's right.
So as a result, a lot of hospitals will have strong incentive to dump patients who are very severe, right? So that, because no matter whether they treat sick or healthy patients, they always get the same amounts, right? So, as a result, hospitals may have very strong incentive to turn down the patients. Only those who are very healthy, who are promising to overcome the diseases, will get treatment from the hospitals.
Yeah, but as we know, now there are more and more Chinese people buying their own insurance in addition to the national health insurance.
Right.
Does that also create a divide between the rich and the poor?
As far as I understand, those supplemental health insurance do not cover hospital care. They only cover major diseases such as cancer, those major, severe diseases that are not covered by national health insurance, right? So as for now, I don't think that will create any health inequality between poor and wealthy people, because it's a very minor supplemental health insurance.
Yeah.
Right.
In the long run, there are concerns about the sustainability of this system. In other words, some people worry that in the end, the system might bankrupt. How do you think about that? As an economist or health economist, how do you see that?
Right. Judging from other countries, because there are many countries adopting national health insurance, and I'm promising. I don't think because along this line, the government will adopt many different policies to to contain the cost. So, and people will be educated. Gradually people will learn that we should not waste the healthcare resources. So I'm promising that we can continue this national health insurance, right? But we can continue does not mean that we can maintain the quality.
That's right. But how do you think that we can try to manage the two? On the one hand, we try to provide the universal coverage of everybody.
Right.
But on the other hand, we're also hoping to improve the quality of the medical service.
To be honest, I think we should increase the copay. We should increase the copay, especially for the less severe diseases, such as if you have a flu, and you go to see the doctors, you should pay more. We should try to. I think we should increase the copay on less severe diseases, but provide more health care to cover more severe diseases.
Yeah.
Right.
In terms of ownership of the medical services, you do have private hospitals, public-owned hospitals, local hospitals, and also the city hospitals and so on. With this kind of very mixture of different hospital systems, how can we, really provide the best quality to everybody in this country?
Traditionally, most of the hospitals in the market are not for profit.
Yeah.
But in Taiwan, we allow physicians to have their own hospitals.
Yeah.
So they are classified as for-profit hospitals. Right. I think it's important to allow the mixture of the ownership now in the market so that they can compete with each other. Well, actually, according to a lot of studies, non-for-profit and for-profit hospitals behave quite similarly, right? But in Taiwan, non-for-profit hospitals, they receive a lot of advantages from the government.
Yeah.
For example, they are exempt from property tax. They are exempt from corporate income tax, which is a huge advantage for them. So they can have more resources, more money to
compete.
Right, to compete. So I mean, if they behave similarly, maybe government needs to think about those advantages granted to non-for-profit hospitals.
Yeah, but
right.
For those big hospitals, especially the so-called non-profit hospitals,
right.
they are mainly based in big cities. They don't really provide the service to the people living in the township.
Uncompensated care. Right.
Yeah. So do you think there's a uneven distribution of the medical services in Taiwan?
I think they do, just like hospitals. Hospitals are like other industries. Even though they provide healthcare services, they save lives, but they are still profit-oriented. They still need to continue their operation. So they still want to try to maximize their profit. So they would tend to locate in area that they can make money. So in that sense, maybe the government needs to, give some subsidies or encourage hospitals to try to, move more resources to rural areas or mountain areas.
Currently, our government is thinking about providing medical service to other countries' people, for them to come here to get the treatments and so on, in order to make profits or to boost our tourism industries and so on.
Right.
Do you think that's a good strategy?
Well, actually, in the United States, as far as I know, many people travel outside, to receive the medical treatment, like open heart surgery or bypass surgery, those very expensive heart surgeries. Those people, they go to India, they go to Asian countries to receive medical treatment. And American people, they question about the medical service provided by other countries. But I think if we can, why not? We should try to promote our medical care services.
But will that affect the local people's, medical service?
Absolutely.
Is that a possibility?
Yeah, it's possible. So, it would depend on the supply of our healthcare system. But, so far I don't see any shortage problem in Taiwan. Like in Canada, for example, in United Kingdom, they also have national health insurance. But the way they they control the budget is to restrict the service. Okay. For example, we can only offer 3 open heart surgeries every month. So if you have heart diseases, you may need to wait like 6 months to receive the treatment, to receive the surgery. Right, but it seems that in Taiwan we don't have this kind of restriction. We don't use this policy to control the budget.
That's right.
Right, so I don't see that right now I don't see that we will have supply shortage problems. Right.
But I think it's for the local people here, they may be concerned about the possibility that the big hospitals will be more willing to provide service to the people who pay more, from abroad, instead of local people who, only covered by the health insurance.
Right.
So that's a concern that people may have.
Yeah, it could be. Yeah, it could be. So I think, if we really want to think about this policy, we probably need to evaluate comprehensively.
That's right. In addition to providing medical service, I think one way to reduce the cost is to educate the people about how to do some preventive works in getting all kinds of medical services. So when we come back, we will talk about whether there are alternatives in addition to these medical managements in reducing the cost of health insurance.
Okay.
So stay with us. We'll be right back.